Tony Fauci responds the next day, the same day, says, "Thanks, not unexpected, but good to have solid evidence behind our recommendations. We now need results of the trials for prophylaxis." So isn't that interesting? It just hit me reading that quote. They make recommendations and then they seek the evidence for the recommendations. Isn't that curious? I'm going to give you a report also on another lawsuit we filed, but we had already filed this one, so I don't need to announce the announcement of the lawsuit. But we have gotten more documents. And this lawsuit, it was another scorcher of a lawsuit. We filed asking for records of any and all emails sent to and from Director Francis Collins, he was then NIH director, related to gain of function, hydroxychloroquine, HCQ, and or Wuhan Institute of Virology. So you can imagine those emails might be very interesting. Now, NIH Director Collins, I think, is technically senior in the bureaucracy to Dr. Fauci. So we could get lots of interesting emails there, and we've gotten some interesting emails previously from this lawsuit. In June 2020, an email from current acting director of NIH, Lawrence Tabak, T-A-B-A-K, he writes to Dr. Collins about an NIH-sponsored randomized controlled trial of the effectiveness of using hydroxychloroquine to treat patients hospitalized with COVID-19. Based on the recommendations from this monitoring board that met today, he writes, they're going to stop the trial. The randomized controlled trial comparing hydroxychloroquine versus placebo standard care in hospitalized patients with confirmed SARS-CoV vaccine, SARS-CoV infection, CoV-2 infection. Again, this is early on, relatively speaking, unfortunately, in the pandemic. It was in June of 2020. This was a scheduled interim analysis, actually the fourth in a series looking at both safety and outcomes. Bottom line, there was no harm signal. So it seemed to suggest, and this was something that was emphasized in the original. However, based on the conditional power analysis, there is less than a 1% probability that HCQ would have proved more effective than standard of care, even if we enrolled twice the number of patients. Therefore, we're concurring with the recommendation and stopping the trial. Okay? So they found that given the results, there was no need to continue the study. So Collins replies and copies Dr. Fauci in the reply and says, well, that fits with the outcome of the recovery trial. Again, that emphasis was in the original. I hope the agency will publish these results quickly, and he says that he's looping in Tony. And Tony Fauci responds the next day, the same day, says, thanks, not unexpected, but good to have solid evidence behind our recommendations. We now need results of the trials for prophylaxis. So isn't that interesting? It just hit me reading that quote. They make recommendations and then they seek the evidence for the recommendations. Isn't that curious? The other big deal in the documents, and there's some other documents about this, is that you had a letter from a group of Democratic congressmen complaining about the decision to cut off EcoHealth Alliance from funding. So despite even then, there was news coming out about EcoHealth Alliance's potential role in gain-of-function research, contrary to the public interest in the least, you had Democrats in Congress sending a letter pushing for more funding or continued funding or renewed funding for that group. Now, EcoHealth Alliance had been funding work at the Wuhan Institute of Virology. Judicial Watch separately had uncovered records showing that Fauci knew, and other folks knew in those agencies, that work was gain of function. We've got the documents. We have the receipts. So this is just kind of an example of information that's important for the American people to have. It would have been nice to know that they had done a study that found that hydroxychloroquine there was no harm signal, but they didn't have enough information, or that it was obviously wasn't working, so they stopped the study. But why is it that we had to sue to get this information? And why is it taking forever and a day to get at it? Because we sued for these records in last year, after they refused to respond to a request we asked for in June for on this topic. So it shouldn't take over almost a year to get this basic information. And I don't know about you, but I oppose the government slow rolling the release of documents about COVID, Wuhan, and gain-of-function research. I mean, we have separate lawsuits against Fauci's agency. Why didn't we get this email already? At this rate, Fauci will be long retired before we even get a partial accounting of his and other activities.
Thanks for tuning in. Be sure to subscribe to our YouTube channel to catch all the latest news from Judicial Watch.